So this is the anatomy of the heart. We can see here that this is the left atrium. This is the left atrium. This is the left ventricle, right atrium, right ventricle. From the right ventricle, we get the pulmonary artery. And from the left ventricle, we have the aorta. Right atrium, it collects blood from the superior vena cava and inferior vena cava. And pulmonary veins, they drain into the left atrium. We have 4 pulmonary veins. So this is from outside. Inside, we have little complicated anatomy. We have here, most important is the right atrium. So we have in the right atrium here the opening of the inferior vena cava. The name is Eustachian valve. So how many Eustachian do you have in your body? Yeah, you have 2 Eustachian tubes, excellent, and 1 Eustachian valve. So Eustachian is related to valve of Eustachy. Who is Eustachy? So Eustachian. So he's Bartolomeo Eustachy. He's Italian anatomist. He's the one who named these tubes in the ears and the ones in the inferior vena cava. Then we have another opening in the right atrium, which is the opening for the coronary sinus. Okay. So this one is called the Bayesian valve. Then we have another opening which connects the right atrium to left atrium, which is fossa ovalis. It's connected to the left atrium through foramen vein. Exactly. Then here in this area we have a muscular part. This muscular part is called crista terminalis. Okay, and from outside this area we can find on the external part of the heart sulcus terminalis. So it's from outside you see a sulcus, and from the inside it's a muscular part. So why are we saying all this? And this is the tricuspid valve leaflet. So this triangle here, we can see beside the coronary sinus, there's a triangle here. Whatever this tendon is called, tendon of Todaro. So we have this triangle, which is called Koch's triangle, K-A-C-H, Koch's triangle. We have a very important anatomical landmark because this is the location for the AV node. So the SA node, it's located in the upper part, rightmost and uppermost part of the right atrium, which is located between the crista terminalis and the entry point of the superior vena cava. This is the sinoatrial node. Then you have internodal connective conduction system. One of them is going towards the left atrium. It's called Bachmann's bundle. Then you have the AV node. It's exactly in the center of the AV ring between the 2 ventricles. Then you have his bundle, still one bundle. Then it starts to divide into the right bundle branch and left bundle branch. And in the end, both the bundles will divide into so many Purkinje fibers. The left bundle branch divides into left anterior fascicle and left posterior fascicle. We will know the importance later. All right? Okay. So the electrical activity when it moves in the heart, the maximum automaticity in the heart is located in the SA node. So electrical activity starts in the SA node, then it is conducted to the atria, to depolarize the atria. Some AV nodal delay in the AV node, as you can see, it's a little slower, and then it conducts to the right and left bundle branches. One more time. All right. So we will stop here and we'll start explaining something about the ECG. Easy so far? It's just introduction so far. As we said, the electrical activity, it moves from one point to another. Thank you so much. Thank you. So, if the electrical activity is moving from one point to another, and the amount of electrical activity gives us the voltage, we need to measure this electrical activity by a device which is called galvanometer or voltmeter, which has a pointer. All right. Much better. Okay. So if you connect this galvanometer with negative end and positive end to a piece of cardiac tissue. This cardiac tissue has cardiac cells, and each cell has sodium channels, calcium channels, potassium channels. So how things work in the heart? First thing that you have the action potential. It looks something like this. First you have sodium influx that gives you the phase 1. Then you have here potassium efflux, phase 2. Then, sorry, this is phase 0. Phase 1, phase 2, phase 3. Potassium efflux. Then you have here the calcium influx in this point. So actually what you have is you have sodium, 2 alphabets, calcium, 2 alphabets, so they have 2 positives. So these 2 positives, they do in flux, both they have 2 alphabets. The potassium, it's 1 alphabet, so it has 1 positive, and it does efflux 1 alphabet. So first thing, sodium channels go in. So positivity, if this is negative originally, all of this is negative. So positivity will start to occur in the cells. Sodium will go in. Okay, this is the depolarization. Anyways, after the sodium goes in this phase 1, the sodium channels get closed. Then potassium starts diffusing inside the cell. So now you're moving from negative to positive. Now again the positive, it started leaking out of the cell, efflux. So when the positive is leaking out of the cell, you're becoming more negative. So you're supposed to fall down back. But the calcium starts going inside, influx. So you're becoming actually more positive, not going down. So the negative and positive will become equal, and you get this plateau phase. Then the calcium influx stops, and the potassium efflux continue. So instead of getting the negative here, you get it in this stage. All right. So if the depolarization is going in this direction, positive, 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 the positivity is going towards the positive, and this tissue has this thickness, so the voltage will be in this amount going to, with the positive towards the positive. So positive towards positive, you get positive deflection of this galvanometer. So it can come like this, or like this, or like this, according to the thickness of the cardiac tissue. If it is not that thick, gives you maybe 5 plus. If it is very thick, it gives you 10, 15 plus. All right. If it happens the other way around, that after the depolarization, imagine now that all of them are, okay, we'll make them all positive. Imagine now that all the cells are depolarized. Now the wave of repolarization should move in this direction also. Yeah? Supposed to be. So now this will become negative. And the negativity will spread in this direction. Negative toward positive, it becomes negative. So if the forces are same and going towards each other, then it becomes positive. So positive towards positive is positive. Negative towards negative is positive. Negative towards positive is negative. Positive towards negative is negative. So if they are same, going towards each other, it becomes positive. So if the repolarization negative is going towards positive, you get negative deflection. Okay? Okay, this is just little tough part. Yeah, it's actually working. Thank you.